Hey everyone, this is Dr. Michael Kaye from the Center for Functional Health, and I hope you are having a wonderful day. So today we're going to talk about arthritis. Anything that ends in the word itis means inflammation. Today we're talking about arthritis, so it's inflammation of the joint. Now we can't underestimate the impact that inflammation has on arthritis. Now some of the arthritis that you might be familiar with is ankylosing spondylitis, gout, juvenile idiopathic arthritis, psoriatic arthritis, reactive arthritis, septic arthritis, osteoarthritis, which is known as OA, and many people are familiar with osteoarthritis because this is the arthritis that affects the weight-bearing joints of the body. So this affects your lumbar spine, it affects your knees, it can affect your hips. And of course, there's rheumatoid arthritis. Many people are familiar with rheumatoid arthritis as well. All right, now, what can we do to prevent and or manage arthritis? So let's first talk a little bit about movement. Movement is important. Now, many patients will say to me, but listen, when I exercise, I hurt. And I understand that. So you have to find the movement that is good for you. What that means is a movement that you can perform that doesn't cause pain, that doesn't cause an increase in inflammation, and allows you to return the next day or the day thereafter for additional exercise. You see, if you're hurting, you won't go back and exercise. So you want to be able to do a movement pattern that doesn't bother you, that helps you so you can return and continue performing exercise and movement. The next question that a lot of my patients ask is, well, what about turmeric? So turmeric is the active compound of curcumin. It's an herb, and there have been some studies to say that turmeric actually helps to decrease inflammation. That curcumin actually helps to decrease inflammation. However, you want to take this in a nanoparticle form. And we talk about nanoparticle form because it has better bioavailability or bioabsorption. So what we're talking about is how well that the turmeric or the curcumin that you're taking gets absorbed into the body, into the bloodstream to give you the management of the inflammation. Now, often a product will be marketed that says it has black pepper in it. And having black pepper in with the supplement of turmeric curcumin allegedly allows for better bioavailability, meaning it gets absorbed better into the system so it can better manage and decrease the inflammation. The problem is with black pepper is often my patients who suffer with gut issues, gastrointestinal issues, can't really use black pepper. So therefore we say, hey, let's use a nanoparticle. It's a little bit easier on the system, and then you get the benefits of decreasing the inflammation. So the next question that we get is, what about the topical agents? So when we talk about the topical agents, we're talking about something that is applied to the skin. So this is something that you would rub in to the joints that are bothering you. And usually you'll see it as a topical analgesic. So an analgesic means a pain reliever. So topical, you rub it in, analgesic, pain reliever. So you may know this as Bengay, deep heating rub, icy hot. In the office, I use China Gel. I also use Biofreeze. And there's another product that I like that is a topical relieving agent, and that's Topricin. So Topricin is, again, something you use topically, and it has homeopathic remedies in it. And Topricin is spelled Topricin. Now, we also see cayenne pepper. So there's cayenne pepper, there's wintergreen, there's camphor, there's eucalyptus. There's these different oils and herbs that are put into these analgesics that you can actually rub over the joint, the area that's bothering you, and it helps to decrease inflammation. Now, lately, we see cannabidiol, CBD. Now, you see CBD everywhere now. Now, CBD is the non psychoactive form of THC. So, you're not going to get high by putting CBD on the skin. And there have been some studies that say CBD is helpful for decreasing inflammation, especially those who are suffering with rheumatoid arthritis. Now, lastly, I want to talk about nutrition. And nutrition plays a role when somebody has ongoing or widespread joint pain. And specifically, we will use what's called an elimination diet. And it pretty much is what it is. We want to eliminate the foods, your trigger foods that are causing the type of arthritic pain or widespread joint pain. And when we talk about widespread joint pain, we're talking about joint pain that's everywhere. You feel it in your shoulders, your elbows, your wrists, your fingers are aching, your toes, your knees. So when somebody has widespread joint pain and there's no underlying infection, then we think, you know what, they're having some type of arthritic reaction. Maybe they're having a reaction or a sensitivity to a certain food. So we will use something like the elimination diet. So we get rid of foods. Now, one of the first things I do is like, hey, let's get rid of the nightshades. Now, nightshades are eggplants, potatoes, tomatoes, and peppers. This will be like a 3-week trial. And then, if the patient says they feel better, we're going to slowly reintroduce those foods one by one to see how they respond or react to that food. Now, often when we do an elimination diet, I get rid of dairy, I get rid of gluten, I get rid of almost all grains, I get rid of soy, I get rid of eggs. So these foods have a tendency to be very highly sensitive to a lot of my patients. Now, after a 3 to 4 week trial of eliminating the food, we're going to assess how that patient is feeling. Then they're going to slowly introduce the foods one by one, because I'm sure you can imagine that if we introduced everything all at one time, we won't be able to figure out what foods are triggering your symptoms. And that's the whole goal. We want to find out what is the underlying food that may be contributing to your ongoing symptoms. Okay, so I hope you enjoyed what we talked about today and how you can help manage arthritis. Now, ways that we can work together is you can join our Facebook group, you can visit our website, and you can also hop on a discovery call where I actually get a chance to speak with you and learn about your health journey. All right, we'll see you soon.